Hi guys, my name is Lucy, and the topic I decided to do was disease control and humanitarian emergencies. So I wanted to start off with a couple of definitions, some terms. So the first one would be disease control, and as defined by the World Health Organization, it is the control as a reduction in the incidence, prevalence, morbidity, or mortality of an infectious disease to a locally acceptable level. They also included the fact that possibly like the infectious disease being eradicated. Um, that's not in all cases as well, so I just chose to include this part. The second definition that I want to go over is humanitarian emergencies. So this is caused by conflict or natural disaster, and it frequently involves the displacements of large numbers of people. The third term that I would like to go over is communicable diseases. And so this is an infectious disease that's transmissible by direct contact with an infected individual or the individual's discharge or by indirect means. So like by like saliva or airborne, foodborne, things like that. Um, a lot of my information, my main source is the World Health Organization, and I'm kind of doing this in the point of view of the World Health Organization. But I made sure to be able to find other sources as well that spoke similarly or the same to the information that they had. So first of all, I want to start off with the objectives. The first objective would be to develop technical standards, guidelines, and tools for communicable disease control and humanitarian emergencies. The second one is to provide operational support on communicable disease control in an acute emergency for protected crises. The third one would be to build capacity on a communicable disease control and emergencies through training, workshops, and education. The fourth one would be to strengthen local and international partnerships. And the last one would be to advocate for health populations affected by the emergencies. So I want to talk about the goal of disease control and humanitarian emergencies. That would be to reduce the morbidity and mortality caused by the communicable diseases in case of a humanitarian emergency. So this is provided by the WHO, by the Department of Health Actions and Crisis, by the country's officials, regional officials, national authorities, nonprofits, NGOs, things like that. And they provide like the support financially and support to train the people as well. With this page, I wanted to include how like our developments that we have now, the necessary developments that we've created over the years, can have an impact on disease outbreaks. So now that everybody uses air and land travel and transportation, it's an easy way for diseases to spread in a very fast manner. Example, what we are currently experiencing right now. And I want to touch up on how the disease control and humanitarian emergencies works. So they coordinate with the communicable disease working group on emergencies. That specific groups works with leading experts in areas such as diarrheal diseases, malaria, acute respiratory infections, TB, human immunodeficiency virus, immunizations, and so much more. And they're the ones that set technical standards for communicable control, rapid technical and operational support during these emergencies. Now for a quick check, what is the goal of disease control and humanitarian emergencies? It is to reduce the excess morbidity and mortality caused by the communicable disease in a humanitarian emergency. Second question, what qualifies a humanitarian emergency? Humanitarian emergency. Anything caused by conflict or natural disaster. Some examples would be armed conflicts, epidemics, famines, natural disasters. And which of the following are objectives given by the World Health Organization? And the answer would be all five of these are the objectives. And this is why we need organizations like the WHO, like the CDC, to be able to train them and have funding. Thank you.